Good afternoon, and welcome to today's Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Improving Our System Together monthly webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet, and the audio function is on, and the volume is turned up. Please be sure your microphone is muted for the duration of the call. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Stillman Bridges and Susan King Lanier. For closed captioning options, select the closed caption feature located on your dashboard. To adjust the video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. Our focus today is June, which is LGBTQ+ Pride Month. At this time, I would like to turn it over to Kelly Crosby, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Awesome. Thank you so much. Hello, everyone. My name is Kelly Crosby. Some of you know me, some of you don't. So I'll give you a little introduction to myself. The real heart of today is an extraordinary panel that we're going to have. So I won't take too much time, but just a little bit about me. I've been in this field for a really long time. I've been with the department for about 15 years and I have over 30 years experience in our field. I am a social worker, super proud of that. I am a person with lived experience, so I'm super proud of that. And that's how we try to center our work here at the division. We think it's very important that we partner with, we listen to, and we support, create, co-create a system that really is led by people with lived experience. So thank you for joining us today. Now, it is obviously Pride Month, as you know, and so I do want to give, I'm glad you're all here. I'm very excited about this panel, and I'm very appreciative for our guests for joining us today. But I need to give a little disclaimer at the start of today's session. You know, we're a government agency, so I want folks to understand that today is not about taking political positions, and nothing that we talk about today should be interpreted that way. Our purpose, as it always is, every single day, is to support mental health and substance use recovery. And we want to do that by listening, learning, and connecting people with helpful resources. June is Pride Month. We're super, super proud of that. And today we have a really extraordinary panel. I promise you, you're really going to enjoy it. And these are LGBTQ+ individuals and allies, and they have lived experience within our mental health and substance use systems. So we need to listen to them. Something else that's really important. We know that people, including us, including me, people's environments, their identities, and their life experiences help shape their wellness and recovery journeys. So one of the things James is going to do is actually give a little bit of context. It's very important for folks to understand the context of the community. And our goal is simply to acknowledge these realities in a very respectful, person-centered way. Today is very much about elevating voices, sharing experiences, fostering understanding. We don't want to talk at people today. We're so grateful to our panelists for their openness and their willingness to share and to be with us today. We're ready to listen, learn, and we're grateful for all of you folks who are joining us in this supportive space today. And I don't ever want to forget our interpreters. So thank you so much to our interpreter staff today. We're so glad that you're here. So with that, I'm going to be on, but I'm going to turn things over to James Miller. James, you ready? James is an incredibly important member of our team here at the Division of Mental Health, Developmental Disabilities, and Substance Use Services. James is unique. We're all very unique, but he has worked in community-based agencies here in North Carolina for a really long time. So he brings a really important perspective to our agency because we want to be really good at not just being the government, doing our best job as public stewards, and that means really working within communities and with community agencies. So James is really good at that, and he's teaching us that every day. But with that, James, I'm actually going to turn things over to you, and I'm here if you need or want anything.
You know I love you, and everybody here does. But thank you so much for being here and to giving us this platform. We could not be more grateful. But to all of our people out there, good afternoon, and thank you for joining the session today on the LGBTQIA plus mental health and lived experience. My name is James Miller. I use he, him pronouns. And previously in a past life, I was the executive director of the LGBT Center of Raleigh here in Raleigh, North Carolina, for the better part of a decade, and currently I am at DMH DDSUS as a population lead, and I get to be the queer population lead, but we use the alphabets instead because we'll talk about that later. The conversation today is intended to highlight and strengthen ideas, programs, policy services that respond to real mental health needs with empathy, with evidence, and with practice-based awareness. My hope is by the end of this discussion, you'll walk away with a renewed perspective on these topics, and that I hope it's shaped by hearing about the lived experience of our incredible panel. So, let me set up. Excuse me. So, in this first slide, we are already here, sorry. Just setting some context around the community in 2026. You've heard from me year after year, and instead of a 101, we get to do something really cool and have a lived experience panel. So just quickly, just talking about 2026 and talking about the topic areas that we're facing right now, the legal landscape is mixed. We are facing a lot of different challenges in a lot of different fields. There's a lot of important federal civil rights, and they're being tested daily. However, state-based rights we're really holding on to, and we know we're on the right side of history, so we're going to make that work. Transgender rights are a primary flashpoint. That is something that is just a fact, and we understand in our lived experience that people fear what they don't know, and if they don't know anybody who is trans or non-binary, it can be a struggle for them to understand what those individuals are going through. Healthcare access is almost always under pressure, understanding even cuts to Medicaid, Medicare, understanding those pieces of, transition services. All of those pieces form a holistic approach to a person. And I think we would be hypocritical if we didn't remind ourselves that mental health also includes physical health, whereas we always say the opposite. But understanding those pieces are very important to the overall health of our community. Public opinion is not moving in one direction. We're bifurcated. In some ways, the community was stronger than ever, and in some situations, we are still fighting for basic rights. And then finally, for many communities within this alphabet soup that we have, the LGBTQIA plus community, equality on paper is not safety in your present life. A lot of people still struggle just existing and walking down the street every day without being questioned, without being read, without being understood as a whole person. And so one thought piece that I want you to have as we go through this panel discussion is thinking about, the basic dignity of a person and what it's worth to you. Next slide. So just getting to this discussion now. During the panel discussion today, I really hope you take away 3 main points. 1, all thinking about LGBTQIA+, the mental health considerations in the service delivery. How do we get to people where they are? How do we serve them the best way we can? How and what is the most appropriate cultural approach in certain situations? And how do we deal with intersectionality? How do we deal with overlapping identities? Second is that I just really want y'all to think about strategies to engage your friends and family, your colleagues, around dignity, around respect, and how everybody is deserving of that. And finally, I hope you'll take away from this presentation a few resources for your specific role to help assist you in building a stronger and safer space for all. So before we move into the lived portion experience, it is important to note that stories are just here to personalize issue. They help illuminate where systems and create safety and where they create barriers and what meaningful support looks like in practice. So before we begin, I'm asking all participants if you please use the chat box and tell us your primary reason for attending today and what your role is. Why are you here? We want to hear about you. Also, in this context, individuals will be posting a link in the chat to a comprehensive guide to LGBTQIA terminology. That way you have some context and some reference as we go through, just in case we start using terms that you're unaware about or you've never heard before. Next slide. All right, well, guess we're starting here. So without further ado, I'd like to introduce you to some of the most amazing people right now. I want you to introduce you to Cameron, Holly, and Crystal. And honestly, they're going to tell you their lived experience better than I will. So Cameron, how about you come on and tell us a little bit about yourself?
Yeah, hi. I'm Cameron Hollister. I use they, them pronouns. I am queer, non-binary, and intersex, which might be new for some people on the call, but I am going to get into more of that today and hopefully really talk about that intersection of mental health and physical health that James was alluding to earlier, because being intersex is medically complicated. But I was joking with James before agreeing to do this panel that I like to think I meet a standard of intersexcellence. I love a good portmanteau, little intersection of intersex and excellence. So I am also autistic and have ADHD, and so I am here because Ginger Yarbrough invited me. If any of you know who she is.
Excellent. Thank you for that. And Ginger she is missed right now. I believe she's on vacation. So I am just so happy she introduced us because you bring such a fabric to this conversation. It's going to be great. Dr. Holly Savoy, would you like to go next?
Sure. Great to be here. So I'm Holly Savoy. My pronouns are she, her. I am a licensed psychologist in the Charlotte area and the executive director of Charlotte Trans Health. I come at this work personally from coming from a family that I came to understand was less accepting of some of my family members when they came out when I was younger. And then my own journey of owning my identity happened later in life as a bi woman, but I'm also het presenting, meaning that I'm married to a man. So, my graduate studies took me down the path of studying affirmative attitudes and identity development. And that just led me down this path in my practice and then to being a part of Charlotte Trans Health. So Charlotte Trans Health is a nonprofit multidisciplinary collective of healthcare providers who are committed to a mission about education, advocacy, and affirming accessible healthcare to improve health equity for trans and gender diverse people. And so I am one of our 13 founding members. We started back in 2012 and have been committed to this work through that time when we knew that finding providers was really hard then. It can still be challenging, but was super hard to find that visibility. So we created some more visibility of providers and focused on educating ourselves. And through that work and my journey and getting to know so many amazing people in the trans and gender diverse community has led me to the work that I'm doing today. So glad to be here. Thank you.
Awesome, Holly. Thank you for being here. Full disclosure, Holly, as the executive director of Charlotte Trans Health, is a grantee of our population health out of the Community Mental Health Block Grant. And I like to brag on her at every meeting because her organization was done with all of their deliverables in 11 months of a 30-month grant. So that should illuminate a little bit of the need in the community. All right, Crystal, you are up.
Hi, thank you, James. Hi, everyone. Thank you so much for having me here today. My name is Crystal Zhang, but you can also call me Wei, Wei, which is my Chinese name. And I use she, her pronoun, and I am a lesbian who married to a Chinese woman for more than 7 years. Um, I am a community health worker and a peer support specialist based here in the RTP, North Carolina. So for over a decade now, my work has been driven so deeply by a commitment to global health equity. So in practice, that means focusing on the LGBTQ plus rights, sexual health, and mental well-being, especially within the API communities. I am originally from China. I have lived and worked across different cultures, which has heavily shaped how I view sexual identity, cultures, and mental health. And it also taught me that the support system can be one size fits all. And as a community health worker and a peer support specialist, I mainly work with the Chinese speaking community in the RTP. And I'm really honored to have the opportunity to facilitate peer support groups for the Chinese parents of LGBTQ plus children, and to work with the Strong Mind Strong community program to conduct psychoeducation sessions among the local Chinese community. For me, it's all about like leveraging the both professional tools and the lived experience to bridge the gap between marginalized populations and the accessible care that they deserve. Yeah, that'll be all. Thank you.
Awesome. Thank you for that. And you're also a part of an organization internally, Tarang, as a
Yeah,
community,
yeah.
and you are also killing it there too. So thank you for being here. Um, Also, just to brag on you, another little pit. This weekend was out Raleigh, and I had the extreme pleasure of getting downtown and being in front with Anne Marie, by the way, if she's even here. And we got to go down and see the Common Women's Chorus on stage, and Crystal was a part of that. It was just great to see.
Yeah.
So, panel, we're going to start it off pretty simple, pretty easy, but pretty straightforwardly. Like, how do you think your lived experience in your own communities has shaped your understanding of mental health? And, could you share a moment when you felt fully supported, maybe unsupported in a healthcare setting?
How are we deciding who goes first? Just
I should have probably said that reverse order. Crystal, go.
Oh, I'll let the other go first. Sorry.
Cameron, you're up.
okay, cool. Hi. Um, yes, so um it's interesting because I have three of these letters in the alphabet soup, and I didn't get them all at once, if that makes sense. I kind of thought that I was just a really weird, complicated little bisexual person when I was in college. And I had some pretty significant medical things going on. And it took until my early 20s to find out that I make significant amounts of both male and female hormones. And so I am what's called hormonally intersex. And I've never done this on camera before, but I've been losing my hair since I was 8 years old. That's why I wear a headscarf. It's a hormonal thing. I have to shave my face. It's like all of the hair has been moving down from my head to my face. I have to have an estrogen implant in my arm so that I don't get cancer. And I get cysts on my ovaries that are so painful when they burst that I've had to go to the emergency room twice for it. And so honest to goodness, it's one of those things where I literally can't walk away from it in my day to day. And also, I have to make a lot of modifications to my physical person. Like, if I don't wear a hair scarf and I walk around like this, a lot of people will ask me if I have cancer, or it will lead to other interactions. People don't really know what to make of me or my body. And so, one supporting thing that has really helped me sort of appreciate myself is I got established with my current primary care doctor about 6 years ago. And I met her completely by accident. She was substituting for my regular doctor at the time. I was getting my estrogen implant replaced, and she was so calm and casual about the whole thing. She had to really quickly learn about my hormonal diagnosis and about the medical complications. And she did not make me feel different. She did not make me feel less than. She has always been very open about what she does and does not know, and I've seen her Google things right in front of me so she can get, a good understanding immediately in the moment. I can go to my appointments without my hair scarf if I want, and she never bats an eye. She's helped me medically manage things in a way that feels good to me, like she's never imposed any treatment upon me that doesn't feel good for me or my body. And having her in my corner for the past 6 years has just been life-changing. So I'm really grateful for her.
Excellent. Dr. Savoy, would you like to add?
Sure. So, as I mentioned, coming from a family where I recognized that folks maybe weren't so affirming, and then coming out later in life, along with my experience as a psychologist and as the director of Charlotte Trans Health, just listening to hundreds of people's journeys as LGBTQIA plus individuals, just has really deepened my perspective on how mental health is not shaped by our identities, but whether we can access affirming care and experience dignity, belonging, and safety in that care. And, think about one experience that has stayed with me, actually happened back when I was in my 20s. Wasn't yesterday. And I brought a concern to my physician, and the response was essentially, well, you get older, things change. I remember thinking, I'm in my 20s, that's older? Like, what do I have in store? But what stayed with me wasn't the comment. It was the feeling that my concern was basically dismissed rather than explored or even, explained to me. And was just talking with one of our case managers in our PATH program today, and they were talking about how one of our clients reported back going to a provider who, for the first time, actually, they've talked about some physical pain they've having, and it was the first time they actually had someone actually stop and examine that part of their body. They've had that overlooked and dismissed previously on multiple occasions. So, it just, those experiences, my own and hearing those, just helped me remember that, we may not remember every clinical recommendation we get, but we do remember feeling seen, feeling heard, believed, and treated with dignity when we're accessing healthcare. And so that's the kind of healthcare that I feel like we should be striving to provide.
Absolutely. Love that answer. And would you elaborate a little more on your PATH project? Because that is the program that is what we're following.
Sure. Yeah, sorry, I talk about that like everybody knows what I'm talking about. So PATH is providing access to trans healthcare, and we are grateful for having the support of NCDHHS and others who support that work, and we provide access to care. So we provide free case management, mental health services, access to psychiatry and pharmacy assistance. We are able to, and care navigation. So we really help people bridge the gaps in navigating our healthcare system, which we all know is not that simple. And so that's the PATH program in a nutshell.
Love it. Thank you. And Crystal?
Yeah, it was lovely to hear Cameron and Holly's comments on their own experience. And I think like there's so many people within the LGBTQ plus community, and there are different ethnic groups. So as a Chinese, identify as a lesbian, I think the biggest challenge that I've faced is also like from within the community, the Chinese community. And I still remember when I first came out as a lesbian to my family. Like it really struck me because my family is trying to understand me, but they couldn't. So at that point, like I was fortunate enough to find a therapist who is Chinese and speak the language and also understand the culture behind it. So for me, I think it is very important to have the access to the mental health services that can really help you to like just speak to your problem. And also it is not easy to find such services, I think worldwide. And so I think for a lot of my fellow Chinese who live in the States, they have been struggling to find the in-language services. And also the therapists or the counseling services who understand you as a LGBTQ plus person. Yeah. So I'm really fortunate to have found a therapist who understand me and speak the language and also got properly trained here. Thank you.
Excellent. Thank you for that. And it leads us into the next question, which is really about the intersectionality that we all experience. And, in my life, I am a cis white man and I have privilege and I understand that. And I think the first step is really understanding where you stand and how to use that privilege to move the dial forward for other communities. So just to the panel itself, and answer as you will for this one, how do factors like race, like socioeconomic status, even the geography, knowing North Carolina is such a large state, how do you think that interacts with, queer mental health and how people access services?
I can go first on this one. Thank you so much. Thank you so much for this questions. It really hits me like close to my home because intersectionality is not just an academic buzzwords. It shows us the survival strategies available to the queer individuals. So in my experience, SES act as a massive amplifier of mental health challenges, constraining choices that higher SES individuals might take for granted. And so I want to share with you a study that I was involved in a few years ago. I worked on a study with a sociologist, Dr. Day Wong at Hong Kong Baptist University, examining how SES shapes marital choices of the LGBTQ plus individuals in China. So it's like by mean the marital choices means same-sex partnerships, heterosexual marriages, and being single or having different relationships. And I'm not gonna dig deep into the findings, but one of the findings indicates that mental health toll of economic vulnerability is that the participant from lower SES backgrounds face significantly higher pressure to conform into traditional heterosexual marriages. So this pressure directly translates into the mental health challenges. So in lower tier regions, living authentically is rarely just a personal choice. It's more restricted by the family economic dependencies and also expectation of filial piety and oftentimes geographic isolation from affirming spaces. So for example, for a low SES queer person, the lack of financial independence means that they couldn't just simply escape the unsupportive environment. and also with a subtle layer of economic discrimination, even within the LGBTQ plus community, individuals at this intersection face a much higher risk of chronic stress, anxiety, and let alone the isolation. So that is why we cannot just discuss queer mental health without addressing the economic and geographic safety.
Absolutely. Well said. Cameron or Holly, do you have anything to add from your experiences?
Yeah, I'd love to speak to the geography component of that. So, I am not a North Carolinian by birth. I'm from a very small rural town in Kansas. And so I, grew up, went to middle school and high school, and saw individuals around me who already knew who they were and were brave enough to come out, sort of go through that in a rural area. There is a lot of, I guess you could say, I think it's coded a lot as traditional values in the community. A lot of, very kind of um, not as much separation of church and state as you might see in a place like the Triangle around here. Um, and so I have, through my work, partnering with DHHS through my job, have had the great pleasure of coming to a lot of rural parts of North Carolina. And I, from even just my own experience, have felt some of that rural fear in being out in some of those areas, and that sort of questioning of safety that I feel when I go back to visit my parents in my hometown. Um, and it's weird because, there are so many parts of North Carolina that I love, and I would love to love the rural parts too. Um, but it's to the point now where I've stopped putting my pronouns in my email signature, because sometimes I have to email people from more rural areas, and I genuinely don't know if having my pronouns in my email would affect my ability to do my job. Um, I was debating on whether or not to share this, but I think I will. When I was in college, I did a summer job in the Blue Ridge Mountains. I won't say specifically where. And in the middle of the summer, I was asked to leave as a direct result of my sexual orientation. This was before I was identifying as non-binary or knew I was intersex. I think, you know, as much as it pains me to say it, because I am, a little Kansas person on the inside, I think geography does have a big impact on the mental health component for queer folks, and for, gender nonconforming and gender queer folks, because, it really is a toss-up how we're going to be treated. And, it would be nice if these were just stereotypes, but I've seen too many real life examples for there not to be some truth to it. And so one thing I would love to see is more outreach to rural areas, and, areas that maybe traditionally haven't had, the highest percentage of out, queer and trans and gender queer individuals. Because we're great once you get to know us, and we just need kind of a space to feel like we can show you who we are. So that way, we have baseline safety, which is pretty important. But I believe that people just need exposure. So that's kind of what I have to say on that.
That's wonderful. And I'm sorry you had to go through that. Obviously, time kind of tries to heal all wounds, but I think we also get to learn from those items. And as someone from very eastern North Carolina, where we had more pigs than anything, people, cars, stop signs, yeah, it's really I see the gaps there, and I understand those people very well. Holly, did you have anything to add for in your experience in working in the community?
Sure. You know, so much that Crystal and Cameron have shared already, but just to add that, like, part of the reason even for us building out our path program is in part for, race, socioeconomic, and geography reasons. We wanted to reach the folks who are under resourced and who, you know, are not necessarily accessing affirming healthcare, or finding safe ways to do that. So we know that in the trans community, you know, so many of the statistics are just, you know, overpowering and kind of devastating about how, you know, under-resourced folks are in so many ways, and especially our Black trans women are most at risk of violence. And, you know, we have a day each year in November, Trans Day of Remembrance, to, you know, remember lives lost to violence, and most of those are Black and brown trans women. So, you know, I just want to highlight, you know, that intersectionality, yes, is so important for us to pay attention to. And when we're thinking about mental health, you know, and healthcare access, you know, if people are having a hard time, you know, with food security or houselessness, like the last thing folks are thinking of is getting to a therapist or getting to a doctor's office sometimes. So we've really got to think about the whole person when we're approaching mental health care.
Absolutely. And I'm glad you brought up TDOR and its counterpart TDOVE in the spring. But TDOR is the Trans Day of Remembrance. We do it every year here in Raleigh, and Charlotte has an even bigger one, I'll say. But one of the traditions is to read the names of the individuals we've lost, because, you know, you didn't get to give them your flowers when you were here. So it's really important that we have those understandings. And just a side plug, because I can't help myself, none of us would have rights without Black trans women throwing bricks. None of us. So I want to make that very clear. We stand on the shoulders of giants, and it's very important we recognize that while we're here. So, and I think this leads a little bit in, and Holly, I'm really interested in hearing your perspective on this, because, you know, as the clinician, you get to see this. How does stigma and internalized messaging affect mental health? And, you know, especially in this community, especially in all of our communities, but then adding the intersectionality to it.
Yeah, I mean, I think, you know, I like to start with just the idea that the biggest misconception we often have is that LGBTQIA plus identities themselves are what's associated with poor mental health or health disparities. And that's not accurate at all. What actually drives all the disparities that we see is the chronic stress of stigma, discrimination, rejection, and the barriers we have to affirming care. And so it's those experiences that become internalized, affecting a person's self-worth and making it harder to reach out and ask for help. So when I think about stigma, you know, it's not really about just acceptance. It's about thinking about building belonging, you know, helping people to, you know, not have to question whether they'll be safe, respected, or valued for who they are. So when I think about addressing stigma, we've got to work at both the individual level and the system level, right? So affirming therapy can help people challenge those internalized messages. And I have worked with folks where, I mean, you know, they're living their best life as their most authentic self and loving it in every way possible. And yet, those internalized messages are still in there. We are still talking through those and healing from those messages that have gotten in there so deep. And so we can do that work, but we also have to reduce the barriers that created those in the first place. So, you know, we want to help people be more resilient, but we can't ask them to be more resilient if we still leave the barriers in place. So we have to work on creating environments that are rooted in dignity and belonging and that access to care if we're going to truly protect mental health.
1,000%. I'm going to say that 100 times. I know that, but y'all are incredible. Crystal or Cameron, do you have anything else to add about stigma and, you know, all these different pieces of internalized homophobia, transphobia, the like?
Yeah, I mean, for internalized homophobia is quite common among the Chinese community, and because of them, like I mentioned earlier, that sometimes they feel the pressure to get into the traditional heterosexual marriage, that they think that they what they're doing, having same-sex relationship, it's like in their way to achieve um, the expectations that their family have for them. Um, no matter if they're in China or they're in here. Um, I feel like a lot of the Chinese international student here, the queer Chinese international student here, they have even more stress because they also have to face the visa status, the legal status here. So it makes that even more, uh, they have more like internalized, not homophobia, not only homophobia, but also the fear of being the true self. Um, so I would say having like all this stress and the pressure, no matter from their lives here in the States and their sexuality, that really adds up to the mental health challenges. And sometimes we often overlook the aspect of them being like international student or like someone not have the like the green card or citizenship here in the US. That I mean, there obviously there are intersectionality elements affecting their mental health. But when like as a peer support specialist, when we talk to them, when we talk to the peers, they often will try to um, like hide a part of their stress. But like getting know the whole is very important to the clinician, I think.
Cameron, gonna give you
Um,
signals.
no, this is all been great. I think like absence is a kind of stigma too, especially like from the non-binary and intersex lens of the experience. Like, for as much as people talk about the extensive terminology in this world, there's still no widely recognized words for when someone's attracted to a non-binary person or an intersex person, or like when a non-binary or intersex person is attracted to someone else. Um, I would be really hard pressed to even name an intersex movie or TV character. And it's wild that I feel like Mothman or Bigfoot on a good day. Like I'm a cryptid, but at least people are somewhat interested by me, and may find me fascinating in some way. Um, and then, other days aren't so good, and I feel like peat moss. I feel like this formless thing buried in the earth that people are only interested in the results of and not the actual content of, if that makes any sense. And I'm just thinking about the wonders it would do for the mental health of my little smaller community within this community if, we weren't made out to be these anatomical freaks of nature. And, there's some interesting studies that probably a much larger population percentage is intersex than we realize because not all of the changes are so physically, like visibly obvious. And so, I don't know, a little normalization would go a long way, I think.
1000%. And I am right there with you. Remind me after this, I got a video to send you because Mothman is a queer icon and I don't care what anybody says. But they also call me the Babadook. So let's be fair. Um, So just thinking about that, and I love that you led into the small incremental small changes that we can make around us, and our peers, our family, our networks. I'm really interested in Crystal's lived experience as a peer support specialist on this. But what do you think the role is of community, the people around you, your network, your family, and how do they, build up or tear down your wellness?
I think this is a wonderful question, and that's the reason why we are here today, right? I mean, I can see the power of community in the peer support groups that I lead. For example, like many Chinese parents of LGBTQ plus children, the first thing they said in our meeting is that I have no one. So here I am. I want to just look for people that can speak to me. Um, they are under so much pressure, and usually they come to us with a lot of self-blame, and they feel like they kind of like have to hide from the normal society, or from the Chinese community they're in, right? And I think the stigma of both mental health and sexual sexuality is quite rooted in the Chinese community. And so these parents are more afraid to seek help for themselves or for their children. So after collating for peer support groups, or just like being in a meeting as a queer person with this face and talking Mandarin, I feel like it did mean a lot to the parents. I'm always touched by them saying that, oh, they feel safe and supported and even educated in our groups, that now they know their children are not alone at all, and seeing this parents coming together and connecting with them truly empower them to step up for themselves. I think that's very important, because they usually, like within the community, they're so afraid to talk about their problem. Like they won't share a thing about their children in their church. So it like when they feel supported and helped, eventually they can support their children in the ways their children desire.
Absolutely. And I love that you brought that up, because at the LGBT Center, I had a youth program for almost a decade, and we had a program called the Youth Coffee Shop. And it was meant to be nothing more than a mitigation of loneliness. It was meant to be, we weren't educating, we weren't trying to do anything. We just invited young people in, have a coffee on us, meet some of your peers, enjoy yourselves. And after the first year, um, it was not unknown to me that parents would drop their kids off and then go commiserate together. And it was incumbent upon me, after realizing, after the first few meetings and seeing young leaders grow up and take control, that I was able to leave that group, and I was able to go take the parents to the Bricks pizza shop next door. Thank you, Benelux, by the way, love you. To take them, and it was really much more of a commiseration and resource sharing and those pieces. And I love what you said there, because that is such an interesting thing about service delivery, is that sometimes the people that really do need the help are the ones that are falling through the cracks. And like, our kids are good. Like, we're moving in the right direction. But just adding that, feel bad. Do y'all have anything else to share, Cameron or Holly? No pressure. You don't have to.
Either one. Cameron, do you want to go first?
No, you go ahead. I'm still cooking.
Okay. Let you keep cooking. I mean, I guess I just come back to thinking, as a therapist, know that the relationship is so key to the therapeutic process. And as humans, we're all wired for connection. So community is just so key to our mental health and well-being. We know that, even the most introverted folks thrive on some amount of connection with others, and, just have seen so much happen through, we run a therapist-led support group. And so having a safe space where folks can come and be their authentic selves and connect with other folks. And so whenever we get to do our group or offer any programs where folks come together, just see so much joy in those spaces, when folks are getting to interact. So chosen family, community networks, you know, any of those folks like are so important to our mental health and well-being. I just can't say it enough, I guess. Well, you done cooking, Cameron?
Yeah, I'm honestly sitting here thinking about how my best friend in the whole world happens to be a trans woman, and like having someone close to me who understands a lot of what I go through just makes my life so much easier. We're kind of each other's unofficial peer supports. Like, she is in a relationship with a young man, and he comes from, very like conservative traditional value background. And she walked into my kitchen the other day and said, "I'm going to have dinner with his parents." And it was like all of these things were out in the open that didn't need to be verbally said, but were understood because she didn't have to explain to me what kind of conversations might come up, what kind of inappropriate questions the parents might ask. Sometimes I'll go to her and I'll say, "Oh, I have an appointment with such and such medical provider." And I don't even have to explain, that I'm probably going to get misgendered or that I'm going to get asked insensitive medical questions. And it's just refreshing when you belong to this community and have people that you don't have to explain everything to. It takes a big cognitive load off. And that understood space is really good for bolstering mental health. And I think that's why chosen family in particular has become such a strong association with the queer community, is because like we really do kind of subconsciously seek out other people who get it.
Always. And that's why Pride is all about solidarity at the end of the day. Excellent. I love where this is going. I hope everyone listening right now is learning so much because I am as well. I'm just tickled. Now, just a slight shift because I think it is incumbent upon individuals in communities that may be more at risk or may have complete deficits in resources to also think about the allies around them and the allyship that it takes to kind of move the dial forward, because at the end of the day, we're no more than 9% of the population. And unless we include bisexuality, then we get 40. Anyways, we'll get back to that later. Everybody's a little bit, you get that. But the understanding is like, how do allies best show up in the spaces you're in? And what do you think are some things that you would like to see genuine support around from people that just want to learn and help? And that's an open question.
I can go first. It's been a while since I've gone first. Okay, so I have two things. So, first thing is just specifically from the intersex and non-binary perspective, like please get used to bodies like mine walking around. I mean, I just took off my hair scarf on camera. I have no hair. I sometimes have stubble, like, a traditional man getting home from work at 5 o'clock. I have a gigantic scar across my chest because I had breast tissue removed for medical reasons. I have fat distributed in different places on my body than someone with a vagina usually might. And none of these things are within my control. I cannot force my hair follicles to change their minds, and I cannot tell the fat in my body, "Hey, I'm supposed to be running on the female hormones, so go to my hips instead of my abdomen, please." That's not how that works. And honest to goodness, like so much of my daily life would be a million times less stressful if I knew that I was going to walk into society and people were going to see a body like mine and go, "Oh yeah, that's a person." and not what is wrong with that one, you know? Um, and I think we could all benefit from that because we all have different weird human bodies, and we are all harmed by the portrayals of beauty standards and such. And then on the lighter end, I love when the allies in my life give me levity. Being part of this community can be so serious and so devastating sometimes. And like the best example I can think of is I have a group of coworkers in my office who have helped me come up with this like alter ego for myself. They call me cue ball, like in billiards. And there's a joke that by night I'm a vigilante, and I'm making people's lives better as like a superhero type. And everyone's like, oh, like it's cue ball with the dome, and just I don't know, like helping me sort of see it as like an awesomeness thing, and not as something that I just have to live with. And so, I think, allies have this inclination to take the movement really seriously and the advocacy really seriously, but unless we're at an event, or speaking to our Congress people to get something done, like we like jokes, we like to have fun, we like talking about interesting examples of LGBTQ people in the media. It is so much more than just like all the serious and heavy stuff.
1000%. I love that. Yes, thank you, Jennifer. I was going to announce just real quick for everybody listening, please use the Q&A panel for any questions you'd like us to answer after we wrap up our, fun facilitated discussion. We'd love to hear it. But Holly, what about you? I mean, we've both of us are very cis, very presenting, and are very rarely questioned on any of that. See, this is what happens when I talk. Now it's fine. The understanding is like we can pass, we can do these things, like, but we still need our allies, right?
100%. And so, I guess I love the levity part, Cameron, and I will go a little bit of the serious part too. Like, to me as a trans ally, I am very much about how can I use the privileges that I have to make an impact, and especially in the roles that I'm in and the hats that I wear. So when I think about allyship, it's really about thinking about its advocacy and action. And it can be big things and small things. It can be, confronting, misinformation, making sure to use pronouns, speaking up even when someone's not in the room, challenging a harmful comment, to being, up in Raleigh advocating for inclusive policies. But it's really just thinking about, really being mindful of doing it even when it's uncomfortable and when no one's watching. I think that's really important for allies to remember, and to also think about how every interaction has the potential to reinforce stigma or to reinforce belonging. And, if we really break it down and think in that way, is what I'm doing in this moment reinforcing stigma or belonging, then maybe that can help, guide our actions a little bit. Because at the end of the day, we want to do things that are reducing that chronic stress that contributes to mental health disparities. And I guess also I think about, how do folks not do harm, as allies? We know that's a risk sometimes. So, I encourage allies to stay curious and keep learning. We've got to sometimes listen more than we speak, and be willing to apologize if we make a mistake, and especially look for opportunities to elevate LGBTQIA+ voices, not just by listening to lived experience, but also elevating voices and ensuring those voices are especially a part of conversations and decisions that affect their lives. So those are a few of the things I try to embrace as an ally myself.
I love that. If you don't have a seat at the table, you're probably on the menu. So we love those pieces. Crystal, do you have anything to add, or would we like to jump to the next?
No, I mean, what I want to say, Holly pretty much cover everything.
Yeah.
Yeah, Thank you.
Always more eloquent than all of us, I know. Thank you, though. But again, I guess we can really think about the systems that we've all been in, and the discussion of seeking out services and having good experiences, having bad experiences, and I love one of my friends come and ask me, hey, I need to find a therapist. I'm like, you're probably going to meet 3 or 4 of them. They're like, what? You don't just sit down and get one? I was like, no, you can click with them. Like, you get to know them, you get to like them, you get to share with them. And it's really interesting to think about how that is that's a whole nother side by side. But for the intents and purposes here, like, how do you in your own lives kind of think about providers and organizations, like, not just doing the bare minimum, not just doing cultural competency, but how do they go to truly affirming healthcare? How do you know when you found that? And if no one's found that, it's okay.
I can start. I mean, I think about cultural competency, and I think about how that's the starting point, not the finish line. It's important for us to, learn terminology, understand health disparities, know best practices, but they don't necessarily automatically make someone feel safe and valued. So at Charlotte Trans Health, focus a lot on talking about not just, access to affirming care, but access to competent affirming care. And we can really break it down to thinking about competency answers, do you know what to do? And affirming care answers, will I be safe, respected, and treated with dignity when I get there? And so, kind of like I mentioned earlier, like, we don't always remember all the details of an appointment, but we do remember, how we felt when we left, right? So, one way to think about it, for providers or doing peer support or any service with community is, are you able to leave that person feeling seen and heard, believed, included in their care, treated with dignity? So, we want to create those systems that foster that for us. So we can learn the basics, but we've got to take it that step further, that it's not just checking a box. It's an ongoing commitment to being curious, having humility and accountability, and especially partnership with folks that we're serving.
Cameron, Crystal?
I literally was just gonna say, I think Holly got it. I have nothing to add to that.
Yeah, I also agree with Holly, and I think it's important to like Holly said at the end, it's important to have defined partnership, because sometimes like for example, like in North Carolina, we don't really have like a queer therapist, right? But we have like Chinese community, Chinese graduate mental health services, and also we have like the Raleigh LGBT Center, Durham LGBT Center, and they can collaborate, right? So I think this is more than each organization can provide themselves. Like when combined, they can do a lot more. Yeah.
Absolutely. So, I mean, we can start winding it down a little bit, but I'm really interested in hearing from your own perspective. And again, Crystal, thank you for leading into this, the resources that are available, the things that we could share and, not necessarily go overboard. This is just a presentation. I am more than happy to field any questions or comments from our group here if you have questions further, but I do want to share a few that I know of, and obviously, like, kids of gender and sexual orientation, SOGIES, as we've tried to switch up a little bit. So, the Trevor Project is an excellent resource for LGBTQ young people in the country. You brought up the LGBT centers. There's one in Raleigh and Durham. Guilford Green is in Greensboro. North Star is in Winston-Salem. Blue Ridge Pride is in Asheville. Holly, Charlotte Has Everything, Charlotte Trans Health, Charlotte Pride, QCHC, a lot of great organizations. And I just got back from visiting the LGBT Center of the Cape Fear Coast. So there's a lot of cool resources, but anything else, any other resources y'all would like to share with the group here?
For the allies, I think you can go look for the local PFLAGs, PFLAG, PFLAGs. So it's like grassroots organization that provide a lot of resources to parents, friends, and allies of the LGBTQ plus community. Even though sometimes it's lacking the in-language services, but it's there. So you can always go to them and see what kind of resources they have. And also they have meetings, they have regular meetings and for both the LGBTQ plus kids and also the parents and friends and family. So I think, yeah, it's a very helpful resource when I first came out to my parents, and they have a lot. And also the local LGBT centers, where in the LGBT center of Raleigh, they have a lot of activities, a lot of meetups, and they have different groups. So especially for the young people, they can go meet people of their they want to mingle with, and also they get a lot of resources as well.
Anyone else? I will add to that real quick about the Carolina Aging Alliance also for older adults. It's statewide and they do a really great job. It used to be a SAGE chapter, which is Services and Advocacy for GLBT Elders. But Holly, do you have anything to add?
I was just going to add on PFLAG too, something I love about them as a resource for families. When a family member of any age, younger or older, comes out, but especially for parents of young ones, is that they can also, at least ours in the Charlotte area, can do kind of matchmaking a little bit, so that, you know, sometimes people are a little intimidated to go to groups, but they can actually be like, hey, you know, we've got a kid around this age, came out as non-binary. Maybe there's actually another family already involved in PFLAG in the network that has a kid around a similar age, and they might be willing to talk one-on-one and meet up for coffee. And so I love that as sort of that foot in the door approach to, you know, helping families and loved ones, you know, find that support they need. You know, I think, you know, just thinking about resources in general, I just always think about that combination of evidence-based resources and organizations. And so, you know, as a healthcare professional, I'm sure, you know, going to highlight things like WPATH, our World Professional Association of Trans Healthcare, that produces the guidelines for affirming care, you know, the American Psychological Association, you know, different resources there, and voices of lived experience. So, you know, finding books and podcasts and resources there, you know, as far as kind of learning goes, to, you know, continue to learn more from folks with lived experience.
Absolutely. Cameron?
What they
Perfect.
said.
You know, it's all, and I'm going to put a link in the chat in just a second to a pretty comprehensive list. Nothing's exhaustive. There's not a lot of great infrastructure across the state to gather these resources. But for our final question, and, you know, being cognizant of time, what changes, big or small, whatever y'all want to think about, would you like to see happen in the mental health field as it regards to queer persons and health and wellness in the next, let's just say, 5 years?
I have kind of a straightforward one. As someone who struggled with SI several years ago, suicidal ideation, I would love for that not to be a problem plaguing my community anymore, because there's absolutely no reason why that should be an added burden for us. We are nifty. We get things done. We add a spice to the world that other people can't. And I'm really heckin' glad I made it. I'm turning 30 in less than 2 months. I'm really excited.
Got my semicolon, girl. I'm here. Gotcha. Crystal or Holly?
I would add to that, yes. And I would love to 5 years or now or whenever see that, affirming care, LGBTQIA affirming care, trans healthcare is no longer seen as a niche specialty, that it is part of standard care, it is part of standard provider education, and it is not about finding the right provider, it is that everyone is going to be treated with dignity and respect and get the care they need where they go.
Yeah, I think for me, so like adding to both what Holly and Cameron have said, like in the next 5 years, I'm hoping to see that like most of the queer folks are able to talk to like their PCP about their mental health, and their PCP understand how to handle them instead of like oh, let me refer you the like I think if like most of them like primary care providers, they are able to um like provide the right services to the people, whoever is seeking help, and also they are able to talk about it, and they feel safe to talk about it. Yeah, this is what I'm hoping to see in the next 5 years.
I love it. That is absolutely wonderful. And for all of our listeners, all the people here, I feel like I'm on a podcast now. I wanted to see if you've learned anything throughout this conversation, would you please put it in the chat? And I think our discussion has really wanted to focus on individual dignity. And so, how do you, as practitioners, family members, allies, how do you center dignity in your own work? Because I would love to hear that. And hopefully, somebody sees something that somebody else is doing and it's sharing resources and you can pick up and run with it. But I was just texted our Director Crosby, has a question, and I didn't really give her a heads up on this. So, if she'd like to come on camera and challenge.
Thanks, James. I guess as a presenter, I can't do a question in the Q&A. So I don't mean to be special to anybody. I just couldn't ask a question there. I'm sorry about that. And this has been phenomenal. I have 3 questions, if that's okay. The first, and I think this last segment kind of answered a lot of it, but I want to raise it anyway because there's some very specific issues that I want to make sure that we're doing a good job to try to address. The first one is, I very much appreciate the conversation about finding a therapist that's a good fit for you. I tell folks that all the time, but I also that is also a position of privilege, if I'm 100% honest, because most of the people that we support don't have a choice of any. Are you kidding me? They wait 6 months for a therapist and they got who they're assigned to. And I just want to be real about that. And so, are there things that you could do to, so folks can help? I know it's going to feel weird what I'm saying, but like, I've always say a good therapist is going to go and get training and support and learn and be real, honest, empathic, make a connection and learn and be honest about that, because they're going to try to do whatever they can for a client who's been waiting 6 months to get in for treatment. But is there anything I just want to be honest, I think with a lot of folks who listen to our webinars, that there isn't a lot of choice, and it's just true. So is there anything that we might recommend to folks to either help their clinicians, or I think some of the things that you mentioned are extraordinary additional supports. We don't always need therapy, but therapy has a time and place, right? So I love that you're sharing all the support groups. I think peers are extraordinary. So anything you'd advise folks who can't get a therapist and don't really have a choice and they don't get to interview anyone, they just have to take what they take or take nothing. So that's one. 2 is just us in the public system. What can we do better? I really appreciate that we just need more clinicians in general. We need better trained clinicians. So like Holly, I love the work that you're doing. Right, we just need, and we can do that. We can support better training. We can support peers. So were there more things we can do here at the state? And the third thing, Cameron, I appreciate you sharing your experience with rurality, right? I think one of the dynamics here in North Carolina that's incredibly important is we are kind of a faith-based state, and faith is for many an extraordinary strength. But for others, I know it's a source of conflict sometimes with their identity and with their families. And so I'm curious if there are any specific, whatever it is, faith-based curriculum, faith-based resources, support groups, anything that we could share, because that seems to be a recurring theme for a lot of folks, that faith becomes an issue for them emotionally, their families, their communities. And it can be hard here in North Carolina where faith is a big part of everybody's lives. And I'm hogging questions, so you can answer one or none of those, anybody.
I was just gonna direct your first question about, raising the education level, the awareness piece of clinicians. And I know Holly has done an incredible job reaching out to other individuals in their networks to lift that up. But Holly, would you like to speak a little bit to that? Because I know, I don't know if I'm allowed to say anything about the website you shared with me, but if you would like to say it,
Yeah, please.
Yeah, I can. So, yeah, provider education is so important, and we know it's still so limited in terms of what we get, mental health, medical, across the board. I mean, I think if folks end up with a provider, a therapist who they just get matched with because of, who's available, I think sometimes it is, unfortunately it's putting added labor on folks, right? But it is the like, okay, that's where we need the peer support groups, the other resources where there's opportunity to connect with community, using the community centers, finding those ways to build on that. And then, maybe sometimes there's someone at one of those spaces that can help that person maybe bring it back to the therapist, or they can find ways to say like, do you know much about this? Like, what are you willing to learn? I mean, I know the last thing we want to do is we're trying to get it away from people having to educate their providers. So I feel like I'm saying to do something that we exactly don't want.
I know. Yeah.
So there is no perfect answer to that, but, I think that is, it comes back to the bind that we're in, right? We want to build the resilience in folks, but we don't want to just focus on building the resilience, which is having to get creative. We want to remove the barriers, which is better educating the providers. And those of us doing this work have got to keep getting into those spaces and pushing to do that education. And that is what I feel like we have been building a lot of in our work, at least in the Charlotte area, of, trying to be that resource that we will come in, we will educate folks. We really want to get the staff folks, because those frontline people are sometimes the hardest to get trained. And you can have an amazing provider, but you've got to get past that front desk.
Excellent point, Holly. Yeah.
Yeah, so focused on that a bit. The website that James referenced, I'm happy to mention. So there is an amazing, or was an amazing nonprofit out there, identiversity.org. So there is a website that is still out there because of changes that have been happening in the world, and where they were growing, and that is not growing right now. I will just put it all that way. We partnered with them to be actually acquiring and taking over identiversity.org. So it is an LGBTQIA educational platform with lots of very accessible information on identities and terminology and various topics in this realm. So happy to share that we will be progressively evolving to hopefully build in more of a healthcare focus with that. We just have not made that like broad public because we're still in the transition process and figuring it all out, but it's official, so I can say it.
Excellent. I put it in the chat for y'all. It, like she said, it is not complete and it's not done yet, but it is really still a good resource. And to speak to Director Crosby's third question, because we just found out we have other questions now. Cameron, just to talk to the rurality of all the pieces, I'm just thinking, as somebody that grew up in Eastern North Carolina, rural Kansas can't be that much different, except we had an ocean, which I win. But the UUs, honestly, and Kelly, I love that you brought up the faith-based component of that because it is a big part of the fabric of Eastern North Carolina. And the Unitarian Universalist Church is generally almost entirely the safest place for individuals of faith to come and understand and share in the worship that they do, especially all the Outer Banks, Atlantic Beach, up to Greenville. The UUs all have a pact to serve LGBTQIA families, which is great. Trans in the South is another great resource. They are a clearinghouse of resources for everybody in the South, but unfortunately, again, it's a funding piece. And also, again, going back to the community centers, the LGBT Center of Raleigh, still kicking, still got great resources up on their website. One thing that I think people forget is that, yes, it's North Carolina, but Virginia might have just as good resources. And the LGBTQ Life Center, it's out of Hampton Roads. It is where my parents went when they needed to figure out what was going on. And I'll say Planned Parenthood was also an incredible resource for my father to kind of just talk it out, which was antithetical in some ways, but it's still great. But Cameron, do you have any other suggestions or thoughts?
So I think this is the part where I say I'm an Ashkenazi Jew and might not have the best advice on the faith-based thing. But
Oh,
I
you're in
mean,
good company. You know that.
but I mean, the whole point of it is supposed to be the love piece, right? And I think I want to bring this back because someone in the chat also asked about like overcoming barriers to information in rural areas. And honestly, I think sometimes people and their own feelings can be the biggest barriers. And one thing that I love doing, me, the individual, as a queer and intersex person, I don't expect others in my community to do this, but like, I love holding space for people to be curious and ask their get to know you questions that maybe others don't have the energy or capacity to answer. I try and save a little bit up because, sometimes people just need more exposure and more information. And so I genuinely think sometimes that, you know, part of the biggest advocacy that I do is just come out to things like this and say, this is an example of an intersex person. This is an example of a queer person. And like once people become pretty convinced that I don't have cooties, then they're a little more receptive to hearing about what that means. And so honest to goodness, I think exposure is a big part of the answer. I don't think the barriers to information or acceptance are super literal in this instance. I think it's literally just meeting of the minds sometimes.
Absolutely. And it's that just experiential thing. If you know somebody, you get to know them, you get to talk to them, you learn a lot more and you get empathy for it. And something I did for the last few years for our division is did Leo 101. And I generally start off with the grandma rule. And I don't know if y'all know what the grandma rule is, but if you're brave enough to ask, I'll be brave enough to answer. So beware. If you want to ask something, you're going to find out real quick. So thank you for that. Jennifer, I know we only have a few minutes left,
Yeah.
but is there anything that you've picked up on? We've been trying to get the chat too.
Yeah, so we have one question in the Q&A, and it is, what are some special considerations for harm reduction and treatment of substance use disorder in LGBTQ individuals?
Crystal, we haven't heard from you in a bit. Do you have any insight?
No, sorry.
It's okay.
I can,
Holly?
and I think, in a lot of ways, it's remembering that, I mean, a lot of the issues are the same. We're coming back to thinking about the minority stress piece, the chronic stress that I talked about, that, we want to understand what's going on for folks to understand the best approach. And, absolutely, sometimes harm reduction is the approach we need to take versus treatment. We've actually had a harm reduction group going for LGBTQ folks in the Charlotte area, and they're about to run their third or fourth round of the group. It's been having some good success. So, I mean, I guess, my best answer to it is really looking at the minority stress piece and what are the, different things going on for that person in their life, and looking at the whole person to help determine what's going to help them either accomplish harm reduction or abstinence from the substance use.
Absolutely. And so just noting the time, I want to be respectful for everybody. I want to thank each and every one of you for giving of yourself to help just give a picture to somebody of what our community looks like, because the LGBT community is not a monolith. We are not all the same. And I hope the key takeaway is that. I hope you're getting the understanding that every person's different. We know that, but every person deserves dignity and respect, and in service delivery and in including and affirmative and responsive systems, we can reduce harm and improve trust across the lived experience of all of us. And I think if people would just remember that LGBTQ issues are not a monolith, like it's just none of us experience the same things. People have privilege, people have other pieces. It's just what it is. It's not a niche issue, it's a public health issue. And it's just in 2026, we still shouldn't have to say that about certain communities, but here we are. So I'm hoping everybody today got a little bit out of this to take away. I learned a lot too. I'm very excited to have 3 new best friends. And I know our audience enjoyed that as well. So from the bottom of my gay little heart, thank you for sharing your time, and I will hand it back over. Thank you.
If we did not get an opportunity to answer your question during the webinar, questions and feedback are welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's event will be posted on our DMHDD SUS webinars webpage. For more information and resources, stay connected with DMHDD SUS by attending our monthly side-by-side webinars and joining our mailing list. The links are included in the chat box. There will be a brief survey following today's webinar, and we would appreciate your time completing it. Our next side-by-side webinar is scheduled for Monday, July 13th from 2 o'clock to 3:30 p.m. We look forward to seeing you then. This concludes our webinar for today. Thank you for attending.